I thank the gentleman. I recognize myself for 5 minutes of questioning. It is, at least to me, it's apparent today in what we've heard, what's gone on here, that Americans now know that government transparency under this administration simply means what you see is not what you get. And that's concerning to me. Ms. Tavenner, do you believe Obamacare was crafted in a way that was transparent to the American taxpayer?
I certainly believe that the work that I've been a part of for the last 5 years has been transparent.
Was Obamacare crafted in a way to be transparent?
I was not here during the crafting of Obamacare.
Ms. Tavenner, would you say the administration is transparent in its implementation of Obamacare then? You've been here for that.
Yes, sir. I think we have tried to be transparent, and we've tried to provide documents, including the documents that we sent yesterday. To date, we've already provided 135,000 pages of documents and provided more than a dozen transcribed interviews. So I think we have tried to be transparent.
But not completely.
Wherever we can, we have been transparent.
Wherever we can. Okay. Another term that could be used in this hearing, whenever we can. I don't recall, probably. Those are reoccurring terms. Mr. Gruber, the Obama administration promised the American people 37 times that if you like your plan, you can keep your plan. When you were working on the law, did you believe, Mr. Gruber, did you believe that no one would lose a plan they liked due to Obamacare?
I believe that the law would not affect the vast majority of Americans.
The vast majority? But did you believe that no one, as the President said, would lose a plan they liked?
As I said, I believe it would not affect the vast majority of Americans, but it is true that some people might have to upgrade their plans because their plans were not comprehensive as defined under the law.
So they couldn't keep their plan even if they liked it?
What the law says is there's minimum standards to be met.
Why did the President make this representation if his experts, including you, knew it was not true? That some, as you've said, would not be able to keep their plan. They would have to upgrade or they'd have to change it.
I'm not a political advisor, and I have no answer to that question.
You acknowledged in a 2013 article in The New Yorker that not everyone who liked their plans could keep their plans, Mr. Gruber. When you knew that the administration's representations to the American people were false, such as in this instance, did you ever voice any concern? Why or why not?
I interpreted the administration's comments as saying that for the vast majority of Americans, this law would not affect the productive health insurance relationships they have. And so I did not see a problem with the administration's statement.
But you're an economist with a model that you've described as entirely accurate. You're a learned professor, and we don't take that away from you at all. And yet the President 37 times said if you like your plan, you can keep your plan. I'm here today to say that in my constituency of almost 800,000 people, Julie Boonstra, a leukemia patient who had a plan she liked, couldn't keep that plan. And she's not stupid. She couldn't keep that plan. Mark and Kate, a young pastor and wife at a local church, now expecting, as of yesterday, cannot keep the plan they had and can't find a plan that's adequate for them to replace it. Dustin, a hardworking young man in my district, spent almost the entire weekend trying to up onto Obamacare from a plan that he lost, he couldn't keep. And as of yesterday morning, I watched him try to get a plan through the website. Through talking with people connected with the website, he still couldn't get it. He had a plan he liked. He's not stupid. He couldn't keep it. Numerous constituents have contacted me saying that while they may have found a plan, under Obamacare. Not necessarily a plan that they liked or they could keep, but found a plan like Mr. Goldman that was reasonable in cost, yet when they got to the point of having to pay their deductibles, their co-pays, their out-of-pocket expenses, or the prescription drug costs, they couldn't afford it. And I would suggest